you have your FDA cleared claims that you've just talked about. What's happening if you're not using VESTEX? What should healthcare workers expect from their standard garments? What are you seeing? I'm sure you've done testing in this area.
There are a lot of reasons why, if you look at the rate of injury and illness in healthcare, it's one of the most, if not the most dangerous place to work in this country. The rate of exposure, colonization, and infection amongst healthcare workers is higher than any other occupation, as you'd expect. They're dealing with sick people. The clothing they're wearing today is non-protective. That's just the reality. It doesn't do anything to protect them. And in fact, what the data conclusively shows, and there's more studies than we can quote, that the clothing is a vector. It acquires, retains, transmits pathogens. As you're sitting there, and ask any nurse that works in the ER or anywhere else in the hospital. It's happened to me. I've been a patient before, and I've gotten sick and vomited on a nurse before accidentally. This is you're changing a catheter bag and you spill urine on you. I mean, that's just the reality of the job. It's a tough job.
Yeah.
The unexpected is the norm, the splatters, the spills. But the reality is you can't wear PPE 24/7. It's hot, it's uncomfortable, it's inconvenient. And one of the things we learned in the first SARS outbreak is even when people wore PPE, 40% of the time they inoculated themselves or their clothing, and it caused infections. We saw the same thing with Ebola, where 2 people died when they took off their PPE, cross-contaminated themselves, and got Ebola. I'm not saying that VESTEX would necessarily prevent that, but it's always better than the non-protective stuff that people are wearing today. So the question you have is, do I want my clothing to be a carrier and not protect me, or would rather wear something that looks, feels, breathes just the same, except I have an added layer of protection for me, my family, and my patients? And that really is the question that people need to ask themselves.